Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. Alright, these questions are all about safe sex. Question number 1. I have the Nexplanon implant, and I'm with a long-term partner. We are both STD-free. If we don't use a condom, how protected are we from pregnancy? So, from pregnancy, very protected. The Nexplanon implant is 99.95% effective when used appropriately, which means don't wear it or keep it in for beyond the indicated either 3 years or 5 years, depending on your provider's comfort. But that being said, as you know, it won't protect against sexually transmitted infections. And when you say you are STD-free, when doctors do STI checks, we don't routinely check for things like herpes or HPV, which can be transmitted silently. So you won't have symptoms, but you might still be passing them on. So that would be one other thing to consider before you make the decision to not use a barrier protection or condom. But otherwise, Nexplanon itself, great at preventing pregnancy. Okay, question number 2. Can you give herpes to someone if you had a cut in the mouth from brushing your teeth? So that's not really the way that herpes is spread. Herpes is more, it lives on the skin and is spread from skin to skin contact. So a cut in the mouth really won't make that much of a difference. What will make a difference is if someone has a history of herpes. And if you were to, say, kiss that person, the chance of you getting herpes if they have an active lesion is pretty darn high. The chance of you getting herpes if they don't have an active lesion, that's a little bit less, but it's not zero, because there is still something called viral shedding, which means, again, the virus lives on the skin and is shed whenever the skin surface is abraded or touched. And so the point is, herpes is more spread through skin-to-skin contact. Highest risk is when someone does have an outbreak, but also possible to transmit without an outbreak too. So just be cautious, be aware. Alright, question number 3. Can you explain what frotting is? I know it's a sexual act, but I don't know what it is. What is it exactly, and what are the risk factors, if any? Honestly, I had to look this up. So frotting is the act of two individuals with penises rubbing the penises together for sexual pleasure. And that's about it. So kind of like dry humping, just rubbing the penises together for sexual pleasure. The risks associated with that. So skin to skin, possible transmission of things like HPV or herpes. And then there would be a teeny tiny chance of transmission of like gonorrhea or chlamydia if there was exchange of the fluids, so ejaculate. There would be a small chance of infection, spreading that type of infection then, but otherwise it's relatively safe considering just the skin-to-skin contact and risk of spreading things that way. Question number 4. Is it possible to get pregnant when he ejaculates on my pants or underwear during dry humping? My period is late. Okay, so unless he totally soaked the underpants or there was semen or sperm that got around the underpants and into your vagina, there would be a chance of pregnancy. So that being said, the chance is very, very low. What I would recommend, if your period's late, take a pregnancy test, but it's unlikely. And then, sounds like you guys are getting close to things, so I might think about birth control or condoms next time. Just think about it. Alright, question number 5. Is it normal to get irregular cramps and bleeding on birth control pills? specifically Nikki. So Nikki is a combined birth control, so estrogen and progesterone derivatives. Super common type of birth control is the combined birth control pill. So yeah, irregular bleeding, abnormal bleeding can be totally normal. It's the most common side effect of starting any birth control form, including pills. And your risk of abnormal bleeding is going to be higher when you start taking the pills mid-cycle. Usually, for most forms of birth control, that abnormal bleeding or spotting should resolve within the first couple, definitely within the first few months. If you are still experiencing abnormal bleeding after taking the birth control pills as directed, so regularly, every day around the same time, if you're still having abnormal bleeding for the first few months, or after the first few months, then you probably could talk to your doctor about switching to a different form that might not have that effect for you. The other thing you asked about is cramping. And really, it might be okay for irregular or abnormal cramping for the first couple of months while your body's regulating, but similarly, your cramping should be pretty predictable thereafter and mostly associated with your periods. So if you're having cramping other times, you probably want to talk to your doctor too and make sure everything is the right dosage and form for your body. All right, that'll do it for this round of safe sex questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.